In a world where immigration policies are constantly shifting, one truth remains steady. Immigrant families deserve safety, dignity, and access to healing. For emerging behavioral health professionals working in underserved communities, advocacy is not optional. It is a responsibility. Trauma, displacement, and systemic neglect impact immigrant families in profound ways. But through trauma-informed policy advocacy and culturally responsive care, we can shift the narrative from survival to healing. In this video, we'll explore how advocacy and policy can support immigrant families. We'll break down trauma-informed approaches, outline actionable steps, and spotlight the work of a community dedicated to equity and healing. Understanding the needs of immigrant families. Immigrant families face more than just the challenge of resettlement. They experience trauma from separation and reunification, fear due to unresolved legal status, cultural displacement and language barriers, lack of access to mental health care, racism, discrimination, and xenophobia. Many flee dangerous conditions only to face new traumas in the systems that should support them. These experiences affect entire family systems and can lead to deep emotional wounds and mental health issues. For behavioral health professionals, it's important to understand that policy directly impacts healing. Trauma-informed immigration policies aim to respond to the emotional, legal, and social challenges immigrant families face. What is trauma-informed immigration advocacy? Trauma-informed advocacy means designing policies that recognize how trauma affects behavior. It also means centering the lived experiences of immigrants and uplifting their voices. Key principles include ensuring safety in all clinical, legal, and educational settings, communicating policy clearly and transparently, providing access to resources and support, honoring cultural identity, building trust between institutions and communities. According to research, trauma-informed advocacy strengthens mental health outcomes and helps immigrant families build long-term resilience. The role of behavioral health professionals. Behavioral health professionals play a powerful role at the intersection of healing and policy. 1. Document trauma for legal relief. Clinicians can provide trauma evaluations or letters that support asylum, U visas, or humanitarian cases. 2. Educate and empower. Help clients understand their rights in systems like school, healthcare, and legal aid. Use accessible, non-technical language. 3. Join advocacy networks. Stay connected with immigrant advocacy organizations. Be part of legislative change and direct action. Policy focus areas that need change. Family reunification. Long delays in reunification harm families. Policies must support fast, humane processes. Mental health access. Only 15% of immigrant families receive proper behavioral care. Services must become more inclusive and culturally responsive. Ending harmful detention practices. Detention centers are traumatic, especially for children. Community-based alternatives are essential. Education for immigrant youth. Language discrimination and lack of mental health support in schools hurt students. Trauma-informed education policies are needed. Community-based healing in action. TAC Healing Rise. TAC Healing Rise is a trauma-informed network focused on family healing, especially in the context of immigration and system harm. Their offerings include Rising Beyond Barriers, a book for immigrant women on healing and entrepreneurship. Bridging Families Workbook, tools for families experiencing separation or reunification. Professional training, frameworks for trauma-informed, culturally aware care. Their approach is not just about delivering services. It's about restoring dignity and voice. Collective healing stories from the community. Rather than highlighting individual cases, community-led practices reveal what's possible. In the Midwest, parenting circles in Spanish and Somali helped families reconnect after detention. In Texas, students partnered with elders to create bilingual wellness guides for immigration clinics. Peer-led mentorships from formerly detained immigrants have provided safe spaces for healing. These stories show the power of collective, culturally rooted support. Actionable steps for advocates. 1. Educate yourself. Recommended resources. Rising Beyond Barriers. Doesn't Carry Paper, Immigration, Trauma, and the Sacred Fight to Belong in America. National Immigrant Justice Center. SAMHSA's Trauma-Informed Approach. 2. Build coalitions. Healing requires community. Partner with legal aid, educators, and spiritual leaders to create wraparound care. 3. Use your voice. Testify at hearings, write letters, or speak publicly for policy change. Use your voice to amplify community stories. 4. Push for language access. Advocate for multilingual services and materials, including Indigenous languages. 5. Center families. Healing happens in relationships. Support policies that prioritize family connection and holistic care. A final call to action. Immigrant family advocacy isn't just about paperwork. It's an act of love, justice, and courage. Let's reimagine our systems through a trauma-informed lens. One that listens, believes, and uplifts. Let us create a world where no family fears separation, where every voice is honored, and where healing is a human right, not a privilege. If you found this video meaningful, please like, subscribe, and let us know your thoughts in the comments.